Good morning, this is Peter Petros from Sydney, Australia. Today I will discuss the squatting-based skilling pelvic floor exercises based on the integral theory system. Fundamental to any pelvic exercise is precise anatomical knowledge of pelvic muscles and ligaments. There are two main types of pelvic floor: Kegel, squeezing upwards, which is a voluntary activation of the puborectalis muscle. Squatting, the skilling exercises, reflexively activates the three oppositely acting natural muscle forces: forwards, backwards, downwards. I will show you videos of these later. But first I would like to talk about the difference in result. Kegel, as we said, are voluntary. They only improve stress incontinence. Skilling, involuntary. The squatting or straining strengthens the pubourethral ligament here, the uterosacral ligament here, and accordingly, if we look at the algorithm, it will improve stress incontinence. The difference is when patients cough with the skilling and they're improved, they don't leak urine. They don't have to squeeze. But they also, skilling, as we will show you later, also improves these symptoms: emptying, frequency, urgency, nocturia, chronic pelvic pain, and even fecal incontinence and obstructed defecation. If we look here, this is from Patricia Skilling's publication. There were 78 patients who finished the course, and there was a 50% improvement. Stress incontinence, there were 69 patients, 82% improved by 50%. Urge incontinence, 33 patients, 68% improved by 50%. Frequency, 12 patients, 83% improved by 50%. Nocturia, there were 32, 29 patients, 90% of the 78 improved 50%. Chronic pelvic pain, 76% of the improved by 50%. And the most interesting thing was the residual urine. 23 had an average of 202 ml, and after the exercises, that reduced to 71 ml. I will show you the organ movements on squeezing upwards. This is also known as the Kegel exercise. Here's a video x-ray. Radio-opaque dye has been inserted into the bladder, urethra, vagina, rectum, and levator plate. Bladder, urethra, vagina, rectum, levator plate. On squeezing, the puborectalis muscle here, which lies underneath the levator plate, contracts in a voluntary way to lift up the rectum, the vagina, and the bladder base, and close the bladder neck. So now we'll show you what happens with Kegel. The puborectalis muscle attaches to the symphysis, posterior surface of symphysis, and it contracts upwards and forwards. So you will see here that there is an upward force pulling upwards on the levator plate. So this will pull upwards and forwards on the levator plate, lifting the rectum, vagina, and bladder base upwards. So you'll see this go upwards and forwards, upwards and forwards, upwards and forwards, upwards and forwards. So we're now going to see a force going upwards and forwards, pulling up the levator plate, pulling up the rectum, the vagina, and the bladder base. And here it is again. The puborectalis muscle surrounds the rectum. It is below the levator plate, and as it pulls forwards, it will lift the levator plate, rectum, vagina, and bladder base. So I'll show you that now. we're resting. This levator plate, rectum, vagina, bladder. It's lifting upwards and forwards. I'll show you that again. Upwards and forwards. Back to resting. Upwards and forwards. Keep an eye on every one of these. So watch the rectum. Okay, now the rectum, you will see, pulls the vagina up. Watch the vagina, right? And the same force pulls up the bladder base. So the skilling exercises train the three natural muscles: forwards to close the distal urethra, backwards and downwards to close the bladder neck. Slide identifies the ultrasound structures in the video which follows. Pubic symphysis is here, space of Retzius here, urethra is here, pubourethral ligament here, the white thing, it comes across and attaches to the mid-urethra and the bottom part of the symphysis. Anterior and posterior vaginal walls, the rectum, here, there's the anus, comes up here, and the rectum comes around here, and the levator plate attaches to the rectum. The puborectalis muscle is tucked away under here, under the levator plate. So the pubourethral ligament has a key role in distal urethral closure and bladder neck closure by three directional muscle forces. You'll see one force pulling the vagina forwards to close the distal urethra. You'll find another one, another two backwards, levator plate pulling it backwards, and then the LMA, longitudinal muscle of the anus, pulling down the levator plate to rotate the bladder and close the bladder neck. So let's see it. Here we go. Now, I want you to look here. You'll see the vagina being pulled forwards by the pubococcygeus muscle to close the urethra distally. Right here. Just watch this. There, you see it's been pulled forward. Now, at the same time, you'll see that there's a backward, the levator plate pulls backward against the pubourethral ligament here. Watch this. Backwards, you see, pull backwards. And you notice it closes the bladder neck here. The downward muscle here closes the back neck. Here it goes. Watch this. The levator plate is pulled down. You see that? Pull down and it closes the bladder neck. Closes the bladder neck. Thank you. I'll just take you briefly through the anatomy here. Sagittal section, bladder, urethra, vagina, uterus, rectum. This is the pubococcygeus muscle, and underneath it the puborectalis. Now we put dye into the bladder. Let's look at it here. There's the urethra, there's the Foley balloon catheter. We can't see the vagina, but we've put vascular clips into the mid-urethra here, into the bladder base here, bladder neck here, mid-urethra, bladder neck and bladder base. And here is dye in the rectum, and we put dye into the levator plate. So what we've done here, we got the patient to squeeze upwards. And you see there's very different pictures between here and here. Now squeezing is voluntary, it's the Kegel exercise, must be learnt, trains the puborectalis muscle, it trains this muscle here to pull the vagina, bladder, rectum upwards. So when this contracts, it pulls the rectum, the vagina and the bladder base upwards to close the bladder neck. But Kegel do not strengthen any ligaments. You can see here puborectalis pulls against the symphysis. So let's see what happens. Now, this is a superimposed squeezing exercise superimposed on the resting. Now, the resting is unbroken lines. Here's the resting. And you can see what happens with the Squeezing, the levator plate is pulled from here to here. You see here? And the rectum is pulled upwards also. And you can see that the bladder neck is pulled upwards and forwards. But more importantly, you can see that the vagina is also pulled up. There is the mid-urethra, and there's broken lines here, goes forwards. Mid-urethra here, broken lines here, goes forwards, and broken lines. Bladder base, broken lines here. So everything gets pulled up. Over here, the squatting straining reflexly activates the three natural closure muscles. You've just seen those in the video. Forwards, backwards, downwards. And here they are. Now, again, the vascular clips on mid-urethra, bladder neck, and bladder base in the vagina. Now, the forward muscle, you can see here, the urethra gets pulled forwards. But the bladder base and the bladder neck get pulled backwards and downwards, and the levator plate gets pulled downwards. You see this? Here is the resting, here is the straining, gets pulled downwards. The rectum also gets pulled downwards. And let's look at what happens in the vascular clips. Now the bladder neck here, resting, gets pulled downwards and backwards, and the bladder base gets pulled backwards and downwards. So completely different movements. The skilling mimics the natural closure mechanism. The Kegel must be learned. So let's spend a little bit of time and look at the anatomy, the functional anatomy. Now this is a cadaveric specimen. It's from my own work, Peter Petros. And you can see that here are the muscles. Well, firstly, let's talk about the organs. Here's the rectum. Here is the vagina. It's been cut off at bladder neck. The urethra has been cut off at bladder neck. Now note that the pubic muscle attaches to the symphysis, and you notice it's collapsed. That's what happens. If you look here, the pubic is actually, when it's tensioned, it's a horizontal muscle. So the pubic and LP are horizontal. LP attaches to the rectum. You can see here. PRM is below it, and it's vertically orientated. It surrounds the rectum, but is not attached to it. And let's look at it over here. But here, the pubic muscle is collapsed, but you can see the levator plate and the iliacoccygeus here also are attached to they call this the pubovisceral muscle. It's attached to the posterior wall of the rectum. The puborectalis muscle is vertical. It's not attached. It just surrounds the rectum. Now here we have the conjoint longitudinal muscle of the anus. It takes fibers from the levator plate and it attaches to the external anal sphincter. And that's the downward muscle force. We can see it here, the LMA. It takes fibers from the levator plate and it attaches to the external anal sphincter. And that's what creates the downward muscle force that rotates the bladder and closes the bladder neck. I'm going to introduce you to the diagnostic model. It is symptom-based, so you put the symptoms here in every box. It summarizes the relationship between symptoms here, ligaments here, prolapses here, and it guides treatment. Now PUL is the main anterior ligament for stress incontinence. So that's stress incontinence, PUL is the cause. USL is the main posterior ligament for OAB, bladder emptying, pelvic pain, fecal incontinence, obstructed defecation. So if they've got these symptoms, and they usually occur together, it tells you the problem is in the uterosacral ligament. Now, this is very important. Even minor prolapse can cause major posterior zone symptoms. So when a ligament is strengthened by the skilling method, that's straining or squatting, or surgically repaired here, then these symptoms all can be improved or cured. And likewise, the straining, of course, exercise strengthens also the front and the back ligaments, and it will improve stress incontinence. So these are results for the skilling, squatting, straining muscles. We've seen these. I've gone through them already. Here's the reference. But there was another study again on the skilling method, and the results are very similar. 50% improvement, stress, urge, frequency. This was 50% improvement, the percentage of patients that achieved 50% improvement. Stress, 78, urge, 61, frequency, 62, nocturia, 75, pelvic pain, 65, urine leakage, and bowel problems. This recorded bowel problems. This study did not. And again, this is the skilling method. Improves both the front ligaments and the back ligaments. The second skilling study actually observed urine loss with pad data. Cough testing, 10 cough tests were recorded before and after treatment, and a 24-hour pad test was reported before and after treatment. So this is the range, and this is the mean. So the post-treatment for cough, you can see an enormous difference, both in the range and in the total. And in the 24-hour pad test, again, a very big difference for urge and nocturia. Urge had 44 patients, nocturia 32. Again, the cough test, 10 coughs, was recorded before and after. This is the range, this is the median, this is the mean. Very big difference. In the 24-hour pad test, after 3 months testing, a very big difference. This was the range, this is the mean, and this was again the range and the mean. Skilling is more than a set of exercises. Fundamental to the skilling exercises is the adoption of a squatting culture. So the patients are told, they can do the feedback, sure, but they are told that they squat at every opportunity during the day, strengthens the 3-directional pelvic muscles and the pubourethral and USL ligaments. Now, if you look down here, it strengthens the forward, backward, downward. But look at this, the downward, when they squat down, or it strengthens the uterosacral ligament. And at the same time, it strengthens the pubourethral ligament. So we tell the patients, do not bend down to pick something up. Get into the habit of squatting down to pick it up. Squat down to play with your child. Squat down for household tasks, such as peeling vegetables. The other important thing is that these skilling exercises work best with premenopausal women. So let me repeat again. The skilling exercises, squatting or straining, work best with premenopausal women. Finally, results for Kegel voluntary squeezing. Squeezing upwards strengthens voluntary muscles, puborectalis muscle, and only prevents stress incontinence on coughing. If Kegel is delayed, the woman wets. Now, the literature shows down here the Kegel improvement rates only for stress incontinence. The range is from 27 to 75%. Supervised biofeedback Kegel exercises are superior to unsupervised for stress incontinence and severity. Overall, incontinence severity index score was significantly better in the supervised group post-intervention. And thank you very much for your attention.